Whether it's a bad sprain, a cough, or something more serious, healthcare is something we all rely on, but it's also facing a workforce shortage. According to the Minnesota Department of Employment and Economic Development, the healthcare industry has one of the highest job vacancy rates in the state. But there is a healthcare career pathways program that's seeing success in boosting those numbers, and it has a bill before the Senate this year. With me is one of the bill's authors, Republican Senator Carla Nelson. Senator, thank you for being here.
I'm so glad you're covering this important topic and this great bill, Bridges to Healthcare.
Senator, let's start at the beginning. Why is there a healthcare worker shortage in Minnesota? How big of a problem is it, and who does that impact?
Well, it's a huge problem. And first of all, there is a workforce shortage in general. But especially in the healthcare industry, part of that is because if we think about 5 years ago, the COVID impact was extremely hard on our healthcare workers. So that's part of it. Also, a lot of times they're long, demanding hours, and sometimes the pay doesn't quite keep up with that. And then we just have a shortage that is growing. Large number of our nurses, for example, are reaching retirement age. So it's very essential. And of course, as our population ages, health care concerns seem to escalate, and we need more health care and we need more healthcare workers.
Senator, the Bridges to Healthcare program started in your district, more or less. So talk me through the program, since you've had a lot of experience with it.
Sure, it did start in R-Rochester. It was very important. It was one of my first terms in the Senate. And what is so amazing about this program is it is a beautiful public-private partnership. And it's that public-private partnership working together, identifying the need, and then connecting Minnesotans with good career pathways leading to in-need, high-demand, good-paying jobs. And so it's been highly successful. In Rochester, we've had great help from our medical communities. The Mayo Clinic is certainly very involved in this, as well as the Rochester Community Technical College, the Rochester School District, certainly working to help Minnesotans get the training that they need to get those good, long, lasting, high-paying jobs.
You mentioned the public to private partnership. Talk to me about the value in a program having that kind of structure.
Well, it's really valuable for a lot of reasons. One, the private sector knows exactly where those jobs are and what jobs are needed, what jobs will be needed, and what training is needed. That is key. And then the public sector is involved in a lot of ways, whether it be helping a single mom with some childcare so she can get this training, or whether it be through public transportation. And so it's a great partnership. And of course, the public-private partnerships do tend to work very well. They're very focused on the individual district and also very much on the job providers, the job trainers.
Senator, I've heard this program described as a win-win-win, and you said it can be a huge success that changes families. So talk me through some of the successes you've heard about or seen.
Sure. Well, the reason it's a win-win-win is because it is a win to help a Minnesotan get the training needed for a good, in-demand, high-paying job with a career pathway once even the job is reached. There's a lot of room to move in that healthcare arena, even into other jobs. And so it's good for the individual, for the family that's raising children. It's very important. But also it's great for the job provider. It's great for making sure those workers are there that are needed. In this case, we're talking about healthcare workers in demand, in need. And so we're providing those workers, those trained workers. And then thirdly, it's good for the community. And quite frankly, it's good for the state. Having those tax revenues come in from those new workers, as well as increasing medical and healthcare fields as well. So it's important for all. And what I know about is I know about new immigrants to our community who have been involved in Bridges to Healthcare training, the internship, the work to get those jobs and then getting those jobs. I've seen that with moms, single moms, and the difference that makes. it's just such a win-win-win for all. And of course, it's a great community that really supports that as well.
Senator, the bill that you have for this program out this session is about maintaining the program's funding levels. But as you've said before, good things multiply and the program is growing. So how is it possible that it's growing but still needs the same amount of funding?
Well, actually, if we did not have a $5 billion projected budget deficit, my ask would be quite different. It's unfortunate that, we had an $18 billion surplus last session. Suddenly now it's a projected budget deficit. And so we have to have realistic expectations. So holding this funding constant, it was $750,000 one time for those 2 years. So we need to maintain that funding, not asking for any more, although if there were more, we know that there would be even more successes, more stabilized families, better personal outcomes, less vacancies in our healthcare entities, and better for our state. But in light of the large budget deficit projected, I think staying at the current course is essential.
Senator, what do you think is stopping the program from growing further?
Well, just that. As you know, it started in Rochester. We expanded into further southeast Minnesota, Austin, Albert Lea area a few years ago. That was very successful. We could expand in many places, but we do have to have the funds to do that. But I will tell you, the pipeline is there and the needs are there. So I'm hopeful we can continue on with this successful program, changing people's lives, impacting Minnesotans, our healthcare industries, and our revenues coming into the state. And I hope that in the next budget, 2 years down the road, we can expand this. We should multiply things that work. We should invest in what works.
Absolutely. Celebrate the successes and build upon them.
Exactly.
Senator, you have also authored Senate File 1506, which aims to encourage more students to pursue jobs in healthcare, specifically in emergency medicine. Would you consider this a companion to Bridges to Healthcare?
Oh, it certainly is. We are taking what's working and we are building up on that in another area, which is the EMS services. And as you know, those are in dire straits, particularly in certain parts of our state. And when someone calls 911, these are often life-altering situations. Sometimes it's the matter of life and death, and minutes matter. Minutes matter. And so it's very worrisome when I have some districts in some ambulance districts in my area that have had to lose their ambulance service. And so this EMS proposal that I have kind of is a bit of the same thing. It opens up training for students. This would be in high school students through PSEO, through Minnesota's Virtual Academy. So it's open to all high school students to get that training that will put them on the path for an EMS or an EMR certificate.
Wow. All right. Now, Senator, you are the co-author to Bridges to Healthcare bill. You have another bill looking to create a Donate Life license plate. You wrote a letter to the U.S. congressional Republicans urging them to protect Medicaid. You're not on Health or Human Services Committee, but you are all over this topic. Talk to me about why these issues are so important to you.
Well, I have been on the health committees for probably 10 years or more. Currently, I'm not. But health is important to everyone. It's very important to my community. We have the renowned Repeat, a nation-leading healthcare system right in my district, right in Rochester, and we want to make sure that that is available to everyone. We want to make sure that all Minnesotans have access to the great innovations that we have in healthcare now. And so it's important that we have the workers and that we also have those emergency medical services as well.
Senator, any final thoughts you'd like to share?
Well, I really appreciate you covering this. Bridges to Healthcare is so important. It works, and these are the kind of things that we should build upon.
Senator, thank you so much for your time.
Thank you so much.